Assalamualaikum and good day to all of you. My name is Khairilanuarbinjaffar. Thanks for giving me an opportunity to present such an important topic named critical care in emergency department. Is it time? To begin with, I have compiled many of important points into systematic presentation, and I hope this can make us easy to understand the topic. So, briefly, I will cover about the definitions of emergency medicine and critical care and definition of both combined. Next, I will go into the main purpose of this presentation. Is it time for the critical care to be implemented in emergency department? Then I will talk about a few challenges that we might face towards making the system established. And finally, I will talk about my conclusion regarding this topic. By definition, emergency medicine is one of new disciplines in medicine that respond to an immediate, unforeseen patient's emergent needs of medical conditions, whereas critical care is medical disciplines that involve in continuations of medical care for people who have life-threatening injuries or illness. Critical care in emergency department is dealing with an immediate, unforeseen, life-threatening emergency conditions that require continuations of medical care. Is it time? To answer this, we should have broad view in understanding the landscape of medical care nowadays. Advances in medical research have made tremendous improvement in quality of life. A lot of research have shown that many newly diagnosed critical illness or injuries, such as sepsis or hypovolemic shock, will have better outcome if they were optimally managed in specific time frame, which is in early treatment. And as we know, critical illness can occur anytime or anywhere. It may develop even before patient reach the hospital or immediately after reach the hospital or also after patient was admitted in the ward. Apart from that, the emergence of other subunits in emergency department, such as general practitioner units, clinical decision units, or multidisciplinary admissions units, give a blessed opportunity for the emergency physician to more into their core business, which is treating the life-threatening or critical conditions. And lastly, when we talk about advantage of having this system, we can decrease the overall hospital length of stay due to the better patient outcome and subsequently reduce healthcare resource expenditure. When we talk about challenges, it more towards having difficulty to implement the system in non-tertiary hospital. Financial restrictions, insufficient number of trained critical care staff, and low volume of patients are all the frequent problems involving the district hospital. When we talk about money, it's about the priority that government willing to give towards people in rural area. Insufficient number of trained staff, not only dealing with the exact lack of number, but also how many of trained staff are willing to serve in the rural area. The low volume of people in rural area indicates less number of patients and subsequently much less number of critical illness or injuries. This result in disadvantage of maintaining the requisite skills needed from time to time. Finally, as a conclusion, I would say that undoubtedly, critical care in emergency department should be implemented in all hospitals in Malaysia sooner or later for the betterment of patient care. With that, thank you.